Welcome to the Synapse NG with Dr. Akinbobola Otitoju, a platform where we spotlight diverse voices and foster collaborations. On today's episode, we shall be spotlighting Dr. Agogo Iwo, and our discussion will be to demystify the unseen battles our cells fight every day, how free radicals contribute to the development and progression of breast cancer. This conversation isn't just about complex biochemistry. It's about understanding the very environment within our bodies that can either foster health or fuel disease. We will explore the science behind the headlines. We will understand the silent fight within and discuss the future of breast cancer management from a fresh and critical perspective. Now, here is a brief citation of my guest today. Dr. Agogo Iwo earned her BSc in biochemistry from the University of Port Harcourt, Rivers State, Nigeria, in 2010. She went on to obtain her MSc and PhD in biochemistry from the University of Ibadan, Nigeria, in 2015 and December 2021, respectively. She was a postgraduate college scholar at the University of Ibadan from 2017 to 2019, and later a TWAS DBT Fellow at the Advanced Center for Treatment, Research and Education in Cancer, ACTRE, Navi Mumbai, India, from 2019 to 2020. Dr. Iwo is a member of the Drosophila Research and Training Center, Ibadan, and currently serves as an early career researcher and lecturer at Chrisland University, Abeokuta. She is also a postdoctoral fellow at the Biotransformation and Oxidative Stress Status BOS Laboratory within the Biomedical and Molecular Metabolism Biomet Research Group at Northwest University, Potchefstroom, South Africa, under the mentorship of Professor Elados Erasmus. Her current research focuses on understanding the relationship between oxidative stress and breast cancer among Black South African women. Dr. Agogo, you are welcome.
Thank you so much, Sarah. I'm grateful.
So, on a lighter note, I have observed something about you and your family, and I would like to spotlight that quickly. How many PhD holders do you have in your house? Hello, did you get that?
I did hear that. My immediate family, we have two PhD holders.
Okay.
Yeah, and yeah, maybe sister is on the way. But presently we have two PhD holders. Yeah.
Yeah, because I've noticed that it's like your family is more of a scholastic family. As you're celebrating one PhD holder, there's another MSc holder in the pipeline, another PhD holder in the pipeline. Congratulations to you and your family.
Oh, yeah. We thank God for that. Why? It's just the humble beginning. Well, because with God have actually blessed us as a family academically. So academically, God have blessed us. We are good, and we're just trusting God to take us through the whole process of academics for those who want to continue in the academic line. So we try to encourage those that want to continue in the academic line, not to just stop in the level of just having a BSc holder, and also even those that are, so for example, my sister that is into the medical field, we are also trying to encourage her not to just stop at the MBBS level, just go further, because sometimes some having this degree is good when you are much younger than when you are older. Yeah, it's easy to read when you are younger than when you are older. So the push is just there. And secondly, because maybe my mommy is a teacher.
Okay.
Yeah, my mommy is a teacher, and so that Z is there also majorly because she wanted to also have some of this degree, but because she got into the family line on time and she had a lot of us as children, she couldn't continue. So we just this is one of the ways to also encourage her. Those things you wanted to do, you didn't do, we are going to do for you.
Yeah, more like the
Yeah,
extension of your
yeah,
mom. That's awesome. All
yeah,
right. So, to the topic today, we are looking at breast cancer, the unseen battle of free radicals in the body. I know that some people they'll be like, what are these people talking about? So, can you please just tell us a bit, maybe define the terms? What is breast cancer, oxidative stress, antioxidants, free radicals? Would you like to do that for us?
yeah. Before I go into that story of breast cancer, I will really want to just say about why I went into this field of cancer. Because interestingly, when I finished my degree as a biochemist in my undergrad, um, technically, if you're a biochemist, you understand that nutritional biochemistry is like the easiest biochemistry when we're doing biochemistry in undergraduate. So by the time I was getting my master's from, I was like, oh, nutritional biochemistry, I'm just going for that. I'm not going to go into any other biochemistry, not drug, not I'm going from nutritional biochemistry because it is easy where I can relate with food also and all of that. So I decided to do nutritional biochemistry in as a specialization during my master's field. But thankfully in the master's program in UI, you have to do all the courses. So it's just a research that differentiates you within the field that you are doing. But most importantly, during the course of that master, I got to understand what cancer exactly is. And during that period, one of my friends, the mom had a breast cancer, had this issue of breast cancer. And then they never knew it was cancer. So when she was explaining it to me during that period, I was like, hope it's not cancer the mom is suffering from already. Like from what you're saying, I think this issue you're already describing is cancer and it has actually metastasized. That is, it has moved, and that is why you're seeing all of this. And sincerely, it was breast cancer. They had cut off the breast, and within a short period of time, the mom passed away. So that was the main reason that pushed me back to studying cancer. Yeah, that was the main reason that made me, by the time I wanted to do my PhD, I was like, I'm going to go into this field of cancer. I need to study this field and be able to explain this field to people better, expose them to it so that they can understand what this thing is all about. People don't really know about this field, what cancer is. They don't really know about it. So basically, breast cancer in human body, we have different tissues and different organs in the body. One of those organ or tissue in the body is the breast. And then when you talk about cancer, cancer is like a growth, but it's not just a growth. It's a growth that is abnormal and is uncontrollable. Like you can't control it. In the body system, there's a system that is able to normalize, I will call it normalize the system of the cell. But in the situation of when there is a cancer situation, the cell cannot normalize again. It just keep growing, growing uncontrollably. And it's not just growing uncontrollably, it is an abnormal growth. And so that is what results to cancer. So when this growth happens in the breast, you say this is breast cancer. When it happens in the breast, you say this is breast cancer. Yeah, an abnormal growth that is in the breast that is growing uncontrollably. That is breast cancer. And different way you will use to understand that a patient will understand that, oh, maybe something is happening in my body as humans, most especially as females, especially because the breasts of the female have different tissues, lymph nodes in the breast that helps in production of milk and all of that. That is the way God have made it for. So as female, most especially, you should be able to know the way your breast look like in a normal situation. And that is they encourage female to do at least a personal self-examination of breasts. Just last month, October was a breast cancer awareness month. So you should be able to know how to personally examine your breast so that you know when there is a change in the normal physiology of your breast. And I will encourage females that are going to watch this link later. You don't do such examination during your reproductive cycle, during your change in menstrual cycle. No, because at that point there is a change in your body system. So you have to do it in a period when you are not close to your menstrual cycle, but at least once in a month you should do that to see if there's any change, is any abnormal growth, abnormal lumps or fluid discharge and whatever change in the shape of the breast and whatever abnormal growth. Just check through to understand if there's any change. And because it is more easier if it is detected on time, it is more safer if it is detected on time. Yeah, it's more safer. So coming back to our topic, by way of introduction, I've been able to say what breast cancer is. But now talking about oxidative stress. So oxidative stress actually arises from two things. I would say two things because one of the terms is a reactive oxygen species, and the second term is the antioxidant system. So oxidative stress is like an imbalance, when there's an imbalance between the reactive oxygen species and the antioxidant system. When you have a higher reactive oxygen species, what do we mean by reactive oxygen species? Reactive oxygen species is basically a system or molecules produced in the body that have lone pair of electrons. In basic chemistry, we talk about electrons in molecules, in atoms. So these atoms or these elements have electrons in them. The electrons revolve around the nucleus. So when it has a lone pair of electron, it becomes radical because there's nothing shielding it from reactive. It becomes reactive. And so it is stable. It keeps reacting with substances close to it. So such molecules are called reactive oxygen species. Why? The antioxidant system, on the other hand, is a substance. When you say anti is something that inhibits. So substance that inhibit oxidation, substances that will prevent the radicals generated by your reactive oxygen species from reacting. So what do? They try to donate electrons to that lone pair of electrons so that it is no longer reactive, it becomes stable. So that is what the antioxidant system does for the body. So when you have an imbalance between this antioxidant system and the free radicals that are generated, resulting in higher free radicals, you have what we call oxidative stress of the cell, of the tissue, of the organism system. That is what oxidative stress is all about.
Thank you. I think we are having a technical session here today on the show. You have taken me back to my University of Ibadan days. And if I may share with our viewers, myself and Dr. Agogo actually have the same school mother, if I may put it that way, person of Professor Oyeronke Odwala. And
Yeah.
I'm a proud product of hers. Now, let me ask this question. Your work focuses on South African women. So what makes this population unique in terms of breast cancer risk, the genetics, or environmental exposure? Can we draw inference from the results, for African continent?
Yeah. So My work presently is focusing on Black South African women.
Okay.
So South Africa as a country is a country that has the Blacks, it has the Indians, South African, it has the whites, and it has those we call the Africans. So those that came from I think Germany and all of that. So they are like Caucasians, but they are not South Africans somehow. So is a mixed racial country exactly. So, but her work is a focus on the Black South African. Most importantly, South African is also a country under the low and middle income country. And we have seen that from breast cancer incidence that the incidence of breast cancer is lower in low middle income country. However, the rate of mortality is higher compared to high income country. Why? Because the low and middle income countries, they get to know late about the breast cancer when they have breast cancer, majorly because of maybe the hospital, clinical facilities, the equipment that are available, early detection equipment are not really there. Also, the cost of treatment also is expensive. Cancer treatment is expensive. And sometimes Africans, we are also religious. So in terms of this, people don't really get to go to the hospital. They have some pains that are unusual. They will not get to the hospital on time. Do we rather pray towards it or use herbal product about it or something else? And as a result of that, it escalates. And so they get to know late at the point when it is of little or nothing can be done about it. And that is why we have high mortality rate of breast cancer. But importantly, it has been observed that the Black South African women have breast cancer early. So they have it in their premenopausal status compared to the white South African women. They normally have it late, but the black South African women have it much more early. And personally, maybe this is a personal view, it may be as a result of the use of contraceptive, combined oral contraceptives. It may be as a result of the use of combined oral contraceptive. Normally, people use it just to prevent pregnancy or menstrual pains, menstrual cramp, and of those things related to it. But it has been observed that contraceptive, because it's a combination of estrogen and progesterone when they use contraceptive, and high level of estrogen have been found to result to breast cancer. So when you take in contraceptive, you just take it to prevent some of those things. Somehow you are, apart from the normal estrogen produced by the human, the person itself, you are actually taking in more estrogen and you are increasing those your estrogen level as a person, and that can result to breast cancer. Higher level of estrogen can result to breast cancer, and so that is why we are looking at Black South African women. And so it can actually be related to other African countries, because we are also observed that you see that some of these drugs that are used in treating cancer, breast cancer, most of them are being developed from patients from high income countries, Caucasian country. So sometimes when we bring it down to the African setting or the low middle, they are not as effective as it should be. Majorly, it may be because of our genetic makeup, It can also be because of the kind of diet we are and our environment also. So we need to look at this to see, is there really any variation? And then as a continent, we begin to think, oh, do we need to develop some of these drugs in relation specifically just for the Africans or just for the low and middle income countries, so that their the treatment will be as effective as it should for the patient as it is for the high income country also. And so that is why we are looking at the Black South African women.
Okay, thank you. I'm actually interested in the diet, all right, considering the financial capabilities of these African countries generally. So how can diet, nutrition, or antioxidant-rich foods contribute to reducing oxidative stress and possibly reduce breast cancer risk? And maybe if you can also name some of these fruits and vegetables that are antioxidant rich, all right, that can help ameliorate or even prevent the onset of breast cancer.
Okay, so diet, as we say, it is said that let your food be your medicine, isn't it? Let your food be your medicine. What you eat goes a long way in determining your well-being. What you take into your body goes a long way in determining your well-being, because knowingly or unknowingly, we are being exposed to a lot of things that can result to various diseases like cancer in our environment. So one way to prevent these diseases is by the diet we eat. Why? Diets are very rich. They are very good diets. What we eat, if we eat well, if we eat good, they are very rich. We have fruits, we have vegetables, which even biblically, when God created the earth, he said that he gave the herbs and he said, oh, take this, eat the herbs for your well-being. So God had a reason for telling us to take in these fruits, this vegetable, because he know that there are a lot of medicinal component present in them. So in our diet, your fruits and your vegetable have a lot of antioxidants content them. I remember when I was in India, they were formulating some medicine, turmeric. Why? There is a lot of flavonoids that is present in turmeric that is effective in protecting against cancer. So there was a drug made from turmeric used in treating cancer patients. So diets are very good. When we eat, we must begin to eat right. That is the best thing we should learn to do now as Africa. There are vegetables that are in our diet. When making this vegetable, we should not deactivate them. Make sure that they are fresh when you are taking them in. Try to make some fruits. You can have varieties of them. Make them as salad, make them as smoothies, make them as even herbs. Just take the herb company. Sometimes as Africans, so we don't like bitter things, but some of those bitter things, bitter vegetables that are really, really very good for us because they have a lot of phytochemicals present in them that helps to prevent some of these diseases. So as a scientist, I will advise that if you can take good fruits, take nuts, take legumes, your beans, take them, your fruits, different types of fruits. You don't really need to. So for example, you may say, oh, I don't have money to get an apple, but you don't really need to get an apple. Eat fruits in season. Mom will say they were taught to eat fruits in season. Eat vegetables in season. At that point in time, it will be cheaper than when it is not in season. So, okra is in season now. Why not get a lot of okra? and eat them fresh, prepare them fresh. Or oranges in season now, why not get oranges at that time? Eat them, they are very good for you. Add them to your food when you are eating, and they are very good for you. So they will help to buy these antioxidant components we are saying. Of course, we have antioxidant components in our system, but we need some antioxidant component we can get from foods to boost up the one we already have in our system to help to eradicate these radicals that are being generated daily in the system.
Dr. Agogo, thank you so much for schooling us this on this episode. I have like I think two more questions to ask. Now, as regards your work, have you uncovered anything surprising or unexpected in your research so far?
Okay, so is the research is a big research, so it's still ongoing. It's a large is a big research, but the first thing we know is that contraceptive also help to increase the reactive oxygen species that is being generated. So patients that make use of contraceptive, because you have a case control situation, you have breast cancer and then non breast cancer, and you try to check the use of contraceptive even among the control patient without breast cancer. You see that the use of contraceptives increases the generation of reactive oxygen species. So that is something we have observed, that the use of contraceptive increases the generation of reactive oxygen species. So for us, we believe that it's better to reduce the use of contraceptive. Yeah, it's better to reduce the use of contraceptive. Yeah. That is what we believe.
That's wonderful. So on this show, I've been able to get from you that one of the things we can, or two of the things we can do to prevent or to reduce the risk of breast cancer is actually, one, reduce the use of contraceptives, and two, to eat balanced diets, especially antioxidant-rich foods, including fruits and vegetables. I just wish that the women that will come to see this program will take to your advice. And so what now, I would love to hear from you, as a woman in science, what advice would you want to give to young African scientists, especially women who want to pursue careers in biochemistry or cancer, or let's say science generally?
Okay. The first thing I will say, the life of a woman is dynamic. Yeah, the life of a woman is dynamic. It's not like a man's life. So, first of all, we should know that the Bible says that when He created the world, He made them both male and female, and He created us male and female. He created Him them. So the first thing I want to speak to every woman is that God did not make us inferior. It was the same spirit, the same bread of life, which He breathed into the men. That was what he gave to us also as female. So as a female, you can be a high flyer in any field, be it science, be it in the heart, any field you choose to become. You can be a high flyer in that field. So never look down on yourself. Know that you have the capacity, just as the may have the capacity. But as I said, the life of of women are dynamic, because we have different phases in our lives. We have different phases. You have that is why earlier I said that it is much more early, when easier when you start your educational process more when you are much younger, it's much more easier for you. It's much more easier for you to study. It's much more easier for you to put in a lot of things. But as I said, as a woman, know what you actually want and put in your best in what you want. The Bible says, in whatever we find our hands to do, let's do it well. Let's do it well. So put in your best in whatever you want, and also know your company. Because in the phases of a woman, you have to get to the point where you get married, where you give birth to a child, or so, to children, or so. These phases matter because the person you get married to have to be someone to support you, for you to move forward in your academic or in your career, in your career journey. So if you don't marry a supportive spouse, you may have to wait a longer time to move on, to be able to get to that place of accomplishment. Or you may have to fight a lot of hurdles for you to be able to get to that place of accomplishment. So you must know what you want, marry right with the help of God, and then be able to prioritize, know what will work for you. It doesn't work for, like, you can't pattern your life according to one particular person. You can't say, oh, because my my friend is putting to bed now, and then she's not going to school, then me, if I put to bed, I will also not go to school. No, for some persons, even when they put to bed, they will still go to school, and they will do very well also. So know who you are, and you know that for that reason, you have to put an extra effort in doing that. So for example, if you put to bed, you have to know that, oh, if I was working at this particular time, I must change my duration, I must change my shift, I must know how to do it so that it will work for me properly. So women, you can actually be what you want God, what God wants you to be. If you put your heart to it, you trust in God, and you are in the right company. You're in the right company. The right set of people matters to encourage you. Because in this phase of, in any career, there is always a downtime. There's always a time when you feel, oh, am I left alone? Am I just doing these things by myself? But you need someone to encourage you to know that, oh, this is not, you're not left alone. People have gone through this phase, and it may just be your phase getting you to the closer end, to the terminal of where you're getting to. That is why you're passing through this. So you need people around you to keep moving, but never stop moving. Some people will say, if it takes you to crawl, keep crawling. A little drop at a time will get you to that particular point. So never stop moving. Keep moving, and you will get to the point of your accomplishment. Yeah.
Wow, thank you so much, Dr. Agogo Igbo. Thank you, thank you. It's so nice seeing you again. It's been many years. And earlier I talked about our school mother, Professor Yeronke. I also want to use this opportunity to shout out to one of our mentors, Professor Vikram Gota of ACTREC. I had such a wonderful time under his tutelage as well. And I believe he also contributed a lot to your career growth. Thank you once again for coming on the show. Sincerely appreciate your time, taking out time out of your very busy schedule. And I wish you the very best in your future endeavor. Do you have any final word?
Oh, final words. First of all, I want to say thank you once again for inviting me to this platform, just to discuss on what we are doing. Final words to women: please be sensitive to your body. Know your body. Know your body, because cells keep growing every day, and of course they have a way of stabilizing themselves or getting to balance. But know yourself. Don't, when you see something unusual, don't keep it to yourself. It's better you check up with your doctor. It's better you check up with your doctor to know what exactly is wrong. Yes, presently we are talking about breast cancer, but I would want to say, as a lady, if it is possible for you to take the vaccine, there's no vaccine for breast cancer now, But there is a vaccine for cervical cancer, which is also another cancer that is affecting ladies. Yeah, if it is possible, please go for your pap smear and get the vaccine just for protection of yourself. Yeah, because cancer is not something that is good at all. It's not something that is good. And so the earlier you know about it, the better